Kia ora, doctors. Welcome to my channel and welcome to my course, NZREXDOC. My name is Amina and I'm international medical graduate. I created this channel to help you and support you, provide for you useful information how to prepare NZREX exam. Today we are going to talk about history taking part, how to approach this part, what type of questions to ask, and I will provide some tips and structure how to do it. Okay, I specifically break it down for you for several parts. So history taking first part, then we will talk about counseling, then we will talk about physical examination part. Okay, so let me open my presentation for you. Just a second. History taking part is one of the most important parts for NZREX exam. And you should know that history taking will be with two different time. So history taking will be two different history takings. Let me explain it. What does it mean? So first, it's focused history taking. The task will be in your instructions, candidate instruction. So they will put it like, please do focused history taking. Or it will be as do history taking. So what's the difference between just doing focused history taking and doing just history taking? So you might think, oh my God, there is no difference, it's same. No, for NZREX exam, it's not the same. Focused history taking means that you have short amount of time to ask all necessary questions related to the symptom, which is provided in your instructions or which is given by your patient. And pure history taking part, station, it means that you have almost 8 minutes to take history. You see, there is time difference. That's why it's very important to stick to your task. If in your task it says do focused history, then do focused history. Okay, don't waste your time for additional questions, for additional extra questions, because you need to do second task, which will be physical examination, or which will be counseling, or it will be also most likely physical examination or counseling, and then it will be followed with a management plan. So all information is taken from your NZREX handbook, or I call it syllabus. Here, this important information. Candidates will be assessed on their ability to conduct a history and seek relevant information from a patient that will allow the synthesis of a differential diagnosis or working diagnosis. Candidates are expected to display an ordered, logical sequence of information gathering in these stations, except where the patient's presentation doesn't allow for this. So what does it mean? It means that your history taking should be precise. You have to ask relevant questions. And there must be DDX questions as well, differential questions. And it should be in order. So you shouldn't jump. For example, if you started with Socrates, please follow the structure of Socrates. Don't jump from where is the pain located? Do you drink alcohol? Or don't jump, okay? Just ask your questions in order. I will show you an example later. So let's move to second slide. What they want from you First, conduct history. Basically, it's take a history. Seek relevant information. So ask tailored key questions. Relevant, which means it should be relevant to your symptom, the symptom that is given by your patient, or the symptom that is given in your task or in your candidate instruction. Okay? Differential diagnosis and diagnosis. History taking should lead to differential diagnosis and diagnosis. I mean, provisional diagnosis. So questions should be relevant. Don't ask unrelated questions. For example, patient has chest pain and you are asking, how's your urination? Have you noticed any changes in your urination? Yeah. You see, this is very like obvious example. I know that you know all of this. Just I wanted to show this example to outline that this is very important because for focused history, you have basically 4 minutes and all your questions should be in your head before you will enter the room with your patient and before you will start this history taking part. Okay? Display in order. Keep the structured approach. So I already said about this. So let's repeat again. So you need conduct history, seek relevant information, differentials, provisional diagnosis, and it should be displayed in order. So good. Important small things that you should know about NZREX exam, how to do history taking part when you will do history taking part. Greeting the patients and introducing yourself. This is important because you will get scores for this part. Please don't start with, so I am Dr. Amina. So tell me, please, how can I help you? What's your complaint? This is very rude. Okay, so you need to start with the greeting. Good day, kia ora. I'm one of the junior doctors. My name is Amina. May I ask your name? May I confirm your name? Can you tell me, please, your age? Can you tell me, please, your date of birth? Thank you so much. It's nice to meet you. Okay, so you have to role play. You have to show that you are really take care of your patient, that you are polite. You have to show your empathy because NZREX exam also assesses for 3 major pillars: patient's interaction, interaction with your patient, patient-centered care, and patient safety. This is 3 major pillars for NZREX exam. Okay, let's continue. Position in the room. So basically, when you enter the room, you will see your patient and you will see your examiner. Of course, you need to greet your examiner as well. So you will say, good day, examiner. I'm one of the candidates. Here is my badge number. And then you will greet your patient. And mostly your patient will be sitting on a chair. So, and you try to sit opposite to your patient, okay? Don't stay like that. Don't freeze. Don't stay. Just you have to, so your eye contact should be on the same level with your patient, okay? Don't stay while you're doing history taking. Okay, this is very, very like, so you're not gonna lose a lot of marks, but this it's not how they work as a GPs here. It's not how they do history taking here in New Zealand. So it's better sit on the chair as well and do eye contact with your patient and start talking to your patient. Look at your patient. Don't look at your examiner like that. Don't stare at your examiner. What should I do? Start your conversation with your patient. Be confident, okay? Talk with the patient, not examiner. Don't look at examiner. I already said about this. Do signposting. What does it mean? After each sentence, when your patient will tell, okay, I have this chest pain, you should say, I'm so sorry to hear that. This must be really bothering you. Then he would talk about some stuff like it started 2 days ago. You would say, oh, I see. Okay, good. This is signposting, okay? Show your empathy. We already talked about this. Empathy, I'm so sorry. It's nice to meet you. What? So, okay. Be patient and use more. I just put it here, these very polite words. Please, may I? Could you? I'm so sorry. Yeah. So when you're doing your history taking part, try to use these words. This is nice, beautiful word that they will boost your scores. Listen to the him carefully. So you have to listen to your patient carefully because he will give you key information which will lead to your provisional diagnosis, differential diagnosis, further physical examination, and management plan. Make short pauses, not long. For example, it's useful when you're asking some information about his family history, make a pause, and then very short pauses, okay? And maintain eye contact. Don't afraid of your patient. Yeah. So yeah, as I just said about this one. So try to act like you're a real doctor and this is your real patient. Because we have this experience. We know how to talk with our patients, right? A standard approach to conducting a history in a hospital setting would be set out in the room of history of presenting complaint, past medical history, relevant family history, current medications and allergies, relevant physiological history, substance use, including smoking, alcohol, and drug use. So when you're doing your history taking part, don't forget to ask about past medical history, family history, SADMA questions. Use this abbreviation SADMA: social history, alcohol intake, smoking, medications, taking regular medications, allergies. Okay. And when you ask questions related to smoking, alcohol, or drug use, before you will explore these questions, say to your patient, I'm sorry, but I have to ask these mandatory questions. If you don't mind, can you tell me, please, do you drink? Do you smoke? Do you take any recreational drugs? Okay? This will show your empathy, how you how you how you approach your patient. This will be more professional. So this is long history taking part. If it's long history taking part, you have to finish by 6-7 minutes. And then it's roughly 6-7 minutes, but sometimes you have time till 8 minutes. Depends to the station, depends to your examiner. He will interrupt you after 7-8 minutes and he will tell you, here is positive findings, and he will give you some positive findings related to your station. Okay? And you have to quickly analyze these positive findings. What will be in positive findings? They can put some positive findings from your physical examination. Even if you haven't done physical examination, there will be some positive findings. Also, these positive findings may include some lab tests with the obvious results. You don't need to worry about the range of lab tests because it will be provided there. and some X-ray results with the interpretation, or ECG with the interpretation. Okay, so you have to quickly analyze these positive findings, and after history taking and after analyzing positive findings, you need to provide provisional diagnosis. At the end of the case, in the early part of patient-centered consultation, the use of open-ended questions is recommended, as this tends to gather more information. Okay, we did these open-ended questions. Closed-ended questions are necessary at times to clarify or expand on points. At the end of taking a history, candidates should have gathered sufficient information about the patient's perspective of the illness to formulate a differential diagnosis. Also, doctors, you have to ask ICE questions, ideas, concerns, and expectations. These questions are must have in your exam almost in each station, okay? So, and all your questions should be open-ended, okay? Not yes, no. Close-ended questions, which leads to answer yes, no, but try to ask open-ended questions. For example, you can use open-ended questions when you use Socrates, right? Can you tell me, please, where is the pain located? How bad is your pain? Can you tell me, please, what makes it better? What makes it worse? Have you noticed any particular triggers? Have you tried any medications to ease your pain? Yeah. So this is open-ended questions. And bullet points. Okay, I told you about patient-centered consultation, your ICE questions, open-ended questions, closed-ended questions to formulate a differential diagnosis. So we discussed this. Let's see the structure. So let me show you. First, we will start with introduction. Kia ora, my name is Amina. I'm one of the junior doctors here. May I confirm your name and your age, please? Oh, it's nice to meet you, Mr. John. Tell me, please, how can I help you today? Oh, you have chest pain. I'm really sorry to hear that. Well, let me take care of you today. First, I need to ask a few questions so better understand your condition. Is that okay? Yes, doctor. Before we will start, I would like to make sure that you are comfortable. Do you have are you in pain now? Would you like me to give you some painkillers? No, doctor, I'm okay. I'm fine. Okay, thank you. So, let me start with questions. Can you tell me, please, more about your pain? So first, you need to explore your symptom. Whatever is given in your task, whatever is given by your patient, first explore the key symptom. In this exam is chest pain. So, can you tell me, please, more about your symptom, chest pain? How did it start? When did it start? Can you tell me, please, where exactly is your pain? So tell me, please, the character of your pain. Is it dull, sharp, aching, tearing? Have you noticed, does this pain spread anywhere else? For example, to your jaw, to your neck, shoulder, arms? Have you noticed what makes it better and what makes it worse? Have you tried anything like painkillers? Does it help? Tell me, please, is your pain getting worse over time? No? Okay, thank you. So this is pain-related abbreviation, SADMA questions. Oh, SADMA question, Socrates, sorry, Socrates. And next one, you will continue with the past medical history. Tell me, please, have you experienced this pain before? Tell me, please, more about your past medical conditions. Do you have any conditions, for example, like diabetes, heart problems? No? Okay. Do you take any regular medications? Okay. Are you compliant with your medications? Mm-hmm. Tell me, please, about your family history. Any history of stroke, myocardial infarction, some heart problems? No? Okay, thank you. So, and then you will ask also, this is important, ROS questions and red flag questions. ROS mean review of systems. But before you will jump to your ROS questions, you need to rule out serious conditions, like you need to ask red flag questions. Can you please tell me, have you noticed any weight loss recently or weight gain? Have you noticed any lumps and bumps in your body? Okay, how's your appetite? Okay, good, thank you. Have you noticed any bleeding? Okay, good, thank you. So just rule out these red flag questions. Also, you can add, have you had any severe dizziness, severe headache, or you can add here any loss of consciousness? No? Good. So, and then you will move to your ROS questions. ROS review of your systems. So ROS questions, basically, they lead to DDX, differential diagnosis. So here, for example, we are talking about chest pain. First system that you need to review is cardiovascular system. You might ask questions from cardiovascular system. Have you noticed any problems with your heartbeat? Any irregular heartbeats? Have you noticed any shortness of breath, especially when you're walking? Okay, have you noticed any shortness of breath when you're lying down? Okay, have you noticed any swelling of your legs? So we're exploring probability of heart failure here. We're exploring any arrhythmias here. Then you will move to your relevant system. What will be your relevant second system? Right? Respiratory system. Respiratory system. Do you have any cough? Have you noticed any recent flu-like symptoms like fever, runny nose, sore throat? From each system, you can ask 1-2 questions will be enough, okay? Then you can move to abdo. I say abdo actually is gastrointestinal system, gastro. So you can ask about what do you think is relevant for chest pain. You can explore the idea of peptic ulcer disease, gastritis. So you can ask, tell me please, do you have any epigastric pain which is in the center of your tummy? Do you feel any burning sensation? Do you have any reflux disease? You might ask, do you feel any acidic taste in your mouth? What else? Have you noticed any changes in your bowels? Yeah, so these questions. If you have extra time, move on. Move on to your other systems like chest pain. What else could be related to chest pain? Okay, musculoskeletal. You can ask about have you had any recent traumas or injuries, especially to your chest? No? Okay. What else it could be? Do you have any joint pain? No? Okay, good. So, and then, so we ask family history, red flag questions, review of the systems. Next one, don't forget to ask ICE questions. This is key, must have questions for your each station. Tell me, please, what do you think is going on with you? What's your concerns about this symptom? What would you like me to do for you today? Okay, thank you. So next, after that, you will do your SATMA questions. SATMA questions, it's almost when you are finishing your history taking part. you can ask one of these questions if it's relevant. Let's think for chest pain, which will be relevant? Smoking will be relevant, yes. Alcohol intake relevant, yes. Allergies, not so much. If you are thinking that you're running out of time, it's better to ask smoking and alcohol, and then we can ask about the allergies. Okay? So I'm so sorry to ask these questions. This is mandatory questions, some sensitive questions. Is that okay with you? Yes. Can you tell me, please, do you smoke? Do you drink? Um, yeah, okay. And also here is stress questions related to your chest pain. Tell me, please, how is the things going on at in your home, at work? Any stress, any recent stress? Yeah. So, and then you can summarize. And then you can summarize. How you can summarize it? You can say, okay, Mr. John, thank you so much for all your answers. Was really useful. Let me briefly summarize it. So you said that you're experiencing chest pain, which is started a couple days ago, and it's getting worse gradually, and it's dull. So, and also you don't have any family history and you don't have any past medical conditions. And I see that you're worried about the possibility of heart attack. Um, so, and quickly, just summarize quickly. Let's say it will take you 20, 30 seconds. Quickly summarize. And then by that time, it's like almost 7, 8 minutes. Yeah. Here, your examiner will give you positive findings. After that, you will analyze your positive findings, analyze your history-taking part, then you will provide your provisional diagnosis, differentials, and management plan. Here, I also added some abbreviations like BINDSMA, DOPS for shortness of breath, for palpitation, CRAFIST, 3Ps for syncope, for nausea and fever. Please review it in your own time. I hope this is clear how you need to do your history taking part. So you have now 2 minutes. So let's say this was long history taking part, and now you have 2 minutes. So what are you going to do these 2 minutes? Okay. After these 2 minutes, you need to provide, oh my God, within these 2 minutes, you need to provide provisional diagnosis, differentials, and management plan. So, Mr. John, from your history and from your positive findings, I'm really concerned this could be the case of myocardial infarction. I'm really sorry to tell you this, but this is quite serious condition, and therefore we need to admit you. Let me explain for you what does it mean, myocardial infarction. So it means that the muscles of your heart is not um, getting enough oxygen, and because of the clot uh, in your vessels, because of the clot from your vessels of your heart. Uh, oh my God, I get so tired. Um, this part, so you need to explain. Let me explain it for you. So I'm So you have now 2 minutes. How can I add this one? Still, can I add it? So why it's red? What color? I want white color. Okay. Okay. Sorry for these technical issues. Oh no. So because for myself, I like these visual things because I can remember it rather than just listening. So therefore, I would like to. So can I write it? Oh no, I don't want to type it. Um. Okay. So his. mm, So you did history taking part. 7, 8 minutes. This is for long history. Okay. When the stations just for history taking part. I mean, you will get 1 or 2 stations with I call them pure history taking stations. So where you need to do basically mostly history taking part, and then you need to provide provisional diagnosis, differentials, and management plan. If it's possible, also safety netting. So, and rest of 2 minutes here, you need to do first, provide provisional diagnosis. Second, differentials. Even it's not, even if it's not asked in your task, provide differentials, you have to provide differentials. Third, you need to provide management plan. So all you should say in 2 minutes. Okay? How we can do this? Mr. John, based on your history and your positive findings, I'm really concerned this could be the myocardial infarction. This is quite serious condition. Therefore, we need to admit you here and do further investigations and give you some treatment. Would you like me to explain what does it mean myocardial infarction? Yes, doctor. Myocardial infarction happens when the clot in your vessels of your heart uh, get stuck there and block the blood supply and oxygen to your muscles of your heart. Therefore, you have this chest pain and shortness of breath, all these symptoms. Also, on your ECG, we found out that you have these signs of myocardial infarction, or we call it STEMI. We've seen these signs of myocardial infarction. Don't say STEMI. Actually, it's medical jargon. And also, I was worried about conditions, other conditions. So, what will be your other conditions? I thought it could be as I was thinking it could be just heart failure. I was also thinking that it's gastritis. Yeah. I was also thinking this is the just ischemic heart disease. Uh, yeah, just angina. What else you were thinking? For NZREX exam, it's enough to provide 3, 4 differentials. But if you have more time, it's okay if you will provide more than 3, 4 differentials. But trust me, in real exam, you're not going to have a lot of time, so it should be done within 2 minutes. You will provide only 2, 3 differentials. After providing the differentials, it's not necessary to elaborate each differential. For example, I was thinking about heart failure, which is blah, blah, blah. No need. Just say it. So your examiner will see your clinical thinking, your clinical logic. And after that, straight away jump to your management plan, okay? Because if you will stuck here and you didn't provide the management plan, you will lose the score Because in your task, it says, do history taking part, provide provisional diagnosis and management plan. Yeah. So that's why you have to provide management plan. Move to your management plan. What will be your management plan? Oops. What will be your management plan here? So your management plan here will be, I'm going to check with my senior doctor and we will admit you for further investigations and further treatment. So further investigations will be, let's say, we need to do ECG, we need to check your heart, we will do echocardiography, we will check some blood tests, we'll check troponin level, some markers of the, some markers. And you can just list all these blood tests, coagulation profile, lipid profile. Yeah. And then by that time, your ring will, so the bell will ring and your examiner will tell you, okay, thank you, move to your next station. Okay. I hope it's clear, doctors. So next, history taking is enough? No. Even if you are in long history taking station, just doing history taking is not enough. Why? Because doctors, in your tasks, they will put also to do history taking, provide provisional diagnosis, differentials, and management plan. This is the most popular, I would say, popular station. And you will have 1 or 2 stations with this structure. Okay. Personally, I call this like pure history taking stations. Because you don't need to do physical examination, because you don't need to do counseling. That's why I call them pure history taking. Because you have 7-8 minutes just to do history taking. I hope it's clear. So next, history taking, diagnosis, differentials, plus physical examination. History taking, diagnosis, differentials, physical examination, plus management plan. History taking, diagnosis, management, plus safety netting. History taking, counseling, plus safety netting. History taking, physical examination, plus management plan. So this, I call them mixed stations. And this is mixed stations. And you will get them 5, 6 stations will be mixed stations. So think about it. Which one is harder? Of course, mixed stations will be harder. That's why you will get like 5, 6 stations will be mixed. Because you need to do physical examination here, counseling, and all this stuff within 10 minutes. Imagine, within 10 minutes. Okay? So this one, doing pure history taking, actually it's easier than this one. So in my course, I teach you how to do these mixed cases, how to approach to these mixed cases, what will be your time management. Yeah, okay. A lot of doctors didn't know about these mixed cases, especially when I started my own preparation. I wasn't aware about mixed cases. They call them integrated stations. Because they added these integrated stations just recently, I think a year ago, they implemented this new thing. Before, it was just pure history taking, physical examination, and counseling. So, integrated stations are one of the most challenging stations because within 10 minutes, you have to do all these things. If you fail, if you were not able to do one of these tasks, for example, you didn't provide diagnosis, you couldn't finish your physical examination, you haven't time for physical examination, you will lose your scores. So you will get score for history taking here, you will get score for diagnosis, differentials, but big amount of scores you will lose from physical examination if you haven't done it. Let's say the score will be 15 for this total score. But for these stations, history taking, they will give 5. Physical examination, they will give, let's say, 7. The rest will go for DDX and differentials. Yeah. So you see, you will lose big chunk and you will lose a lot of scores from here. Therefore, it's important to role play and practice, practice, practice. Practicing will help you to nail these mixed cases. I call them mixed cases. Actually, they are integrated stations. So I hope this was useful for you all doctors. I wish you good luck. If you're interested to enroll to my courses, please, you can email me or just comment down below. And of course, like everyone on YouTube channel asks, please put your likes, provide the comment, and subscribe. Okay, thank you so much. So